Welcome to Speaking of Business. I'm Goldie Hyder. We've heard the calls from health officials for weeks now. Stay at home and don't go out unless absolutely necessary. The fight against COVID-19 depends on physical distancing. But for many people, finding a safe space is easier said than done. Frontline workers, for example, worry about bringing home the virus. Hospitals are scrambling to find enough space for infected patients. And sadly, many Canadians don't have a safe place to call home at the best of times, let alone during a pandemic. My guest today is a problem solver when it comes to meeting housing needs. Rod Graham is president and CEO of Calgary-based Horizon North Logistics. The company designs and builds modular housing units and other prefab structures that can be deployed quickly to meet a wide variety of short and long-term needs. Rod Graham, welcome to the podcast.
Excellent. Thanks very much, Goldie.
So let's start off. What kind of help and support are you offering in this pandemic? What is Horizon North Logistics able to do to help with the situation we're in?
Yeah, let's talk kind of on a three-pronged approach. We'll talk about our own folks. We do have a couple of thousand employees, and we've offered the ability for people to work from home. And so we have put what I characterize as high-quality IT infrastructure into people's homes to allow them to be safe and allow for them to continue to keep our business operating, but from a remote location. And so that's our own folks that are on the corporate side of our equation. We have two other lines of business. So one is remote workforce accommodations, and the other one is modular construction. And so I wouldn't mind, Goldie, just taking you through what we're doing in each one of those lines of business, if that's okay today.
Sure. Why don't you do that?
Excellent. So on the remote accommodations portion of this, we operate in 30 plus locations. And I've had all kinds of feedback as the CEO of this organization about why are you still exposing folks? And I'm not going to get into the philosophical debate of why that indeed is the case. What I want to do is make sure that our folks are secure. They can come to work feeling that they are getting appropriate hygiene protocol and continue to kind of keep our economy going, Goldie, which I think is an imperative as we go forward. So as we talk about some of the remote communities that we do work in, we've taken a number of steps to make sure that our folks are well taken care of. When these individuals do fly into a region, and if it's a remote region, temperature checks when they first arrive. They would effectively have a series of hygiene protocols for entering our facilities. They're provided with PPE as they continue to kind of migrate and move forward in supporting guests that might be operating in a mine, oil sands facility, liquefied natural gas facility, potash. So a lot of these locations, quite frankly, can't be turned off. There is a continuous flow component to it. And so our folks, again, are coming into these kind of facilities, and they are providing food services. They're providing housekeeping, janitorial, maintenance, and to keep these facilities open and progressing forward, like I said, temperature checks, hygiene. Transportation, it's a checkerboard type of a process in terms of where people sit. If there is a smaller vehicle being utilized, only 2 individuals in the vehicle, lots of physical distancing. When food is being served, the number of folks that can sit at a table is the high count of 1. So obviously from an efficiency perspective, not a high efficiency, but really kind of the way we look at this is protecting our guests that are coming and protecting our employees as they operate in this environment. And then finally, Goldie, you're quite aware of our dedication to working with Indigenous communities. I can tell you in some of our more northern communities where we are dealing with Inuit folks, we have been very sensitive to the desire for a number of these communities to effectively insulate themselves from outside influences. And so workers that we have had, and a number of them are Inuit in nature, we have put them back into their communities and continue to pay them because it's just the right thing to do to operate in those types of jurisdictions.
Well, you've anticipated my second question about safety, so we'll skip over that one because that was a very thorough response on your part, and thank you for sharing that with us. Another area that I wanted to explore with you, knowing that you work in remote areas, is of course the issue of the work that you're doing with Indigenous communities. What concerns you the most about the impact of the virus in remote areas, and specifically related to the challenges of Indigenous communities?
Yeah, the biggest challenge, Goldie, and I had the privilege of being able to talk at one of your panel discussions last year, is just the lack of infrastructure within these communities. And that's why we're hypersensitive to working in a series of these northern communities. Quite frankly, an incident that would occur in a remote location would never have the appropriate health infrastructure if it became a pandemic within that community. And so that's why we would try to be preemptive in allowing for individuals from communities to go back to those communities and continue to at least provide them a base of payments so they can pay their bills within community. I see a real opportunity, and I know that our federal government, provincial governments have been looking at this as kind of a unique opportunity through this pandemic to improve the quality of healthcare infrastructure within communities. And that leads me to the other part of our business, which is modular construction and the ability for us to build nursing stations and healthcare units in relatively short order. And because they are modular, they're able to be transported. And quite frankly, I think there's an opportunity for us to finally come to that longstanding obligation that we have to our Indigenous folks to improve the quality of life and quality of infrastructure within community. And so I think there is a unique opportunity for effectively these medical units to be put into every community. Quite frankly, everyone deserves to have at least a base and standard of care within their area. And I think this is kind of a unique opportunity for our federal government, provincial governments to implement such a plan.
Well, look, let me ask about leadership. You talked about this being a unique opportunity. Of course, it's a very unfortunate, unique opportunity, but it's often said the leaders can be made in a crisis situation. What are you learning about being a leader? What are you learning about leadership in terms of takeaways from once this crisis is over?
Yeah, I viewed this crisis as a war, Goldie. It's indiscriminate in terms of age, gender, race. It attacks anybody. Quite frankly, we're all exposed in some manner. And so it, I think, has become a very interesting leveling conversation for certainly our leadership team as we talk through the fact that all of us are, quite frankly, at risk. So from a leadership perspective, I make sure if there is concerns, people can email me within other communities we operate in or our own employees. And I make sure I get back to them by myself. I don't kind of put an intermediary just to talk through what we're doing from a protocol perspective. As well, I participate in conversations with provincial ministries. Obviously, given the fact we are running industrial work camps, it is a priority for ministers of health within multiple jurisdictions just to make sure that we do have safe protocol. And I can tell you that our pandemic response, our COVID response plan is one that, quite frankly, has been embraced by a few of the provincial ministries. And so from a leadership perspective, making sure we are working with as many government bodies as possible. This is not the time to effectively hide. It's time to be out and identifying kind of how we are looking to kind of work our way through this war is what I call it.
Well, that's well said. And the war continues. I want to thank you for joining us today and giving up some of your valuable time to share your insights and the great work that you and your colleagues are doing now and on an ongoing basis. So thanks for taking the time today, Rod. We really appreciate it.
Goldie, thank you again for the opportunity to speak.
Rod Graham is President and CEO of Horizon North Logistics. If you would like to hear more of this special Speaking of Business series, conversations with our CEOs about the COVID-19 crisis, you can find them all wherever you get your podcasts, or simply go to our website, speakingofbiz.ca. That's biz with a Z. Until next time, I'm Goldie Hyder. Thanks for joining us.